Hello viewers, good morning. This is Dr. Ali Atiq. We have met before, but we have met in the webinars. But this time we have came up with a very interesting show. And this time we are going to talk about pets like we have done earlier with Dr. Shahryar Afzal over here. Now, today's topic that we are going to discuss is pet and their tender, loving care. Now, without further ado, let me give a very brief introduction about our guest. Dr. Shahryar Afzal is a PhD in pharmacology. He is from Department of Pharmacology and Toxicology, and most importantly, he is a vegetarian. So, with this live show, I'm a pet lover, so I'm going to ask a lot of questions, and so as my other guests over here, who are eager to know about their pets, their diseases, and how to make it more a loving environment for their pets. So thank you so much, Dr. Shahryar, for joining us. And because I have dogs at home, so I need to ask a few questions first. And I will start straight away with the questions. All right. So, of course, animals can't talk. And when we talk about the pets, it can be cats and dogs and a range of animals. And they can't speak, right? So just by looking at them, we do understand that there's change in their behavior, there's change in their appetite, right? And of course, the behavior may be changed towards their owner as well. So I really want you to please give some insights that what are the important things that we should look at when we own a pet that can tell us that the animal or the pet that we own is unwell, not feeling well.
Thank you very much, Dr. Ali, for the very well introduction, and thank you, Masa University, for granting me another opportunity to go for my this live session with my audiences. So, with your question regarding the pets, what kind of the features and what kind of the problems we are going to look into these. So, first of all, most important thing that we should know that ownership of the pet is a very important responsibility. In that regard, you need to have to spare the time with them, because you have to train them. You are going to make them as a part of your life. So if you cannot spare the time, that you cannot give them the proper attention, so then I think it's not a proper wise choice that you are going to keep a pet. So you have to make the research before you keeping that, and then you also have to make sure that either of your family members, they're not going to have some sort of the allergies while you keep the pet. Then, since I told you already that it is keeping the pet ownership is a responsibility. So how we are going to own this responsibility? What are the important things we should keep in consideration while keeping this responsibility? We should know about the normal features. We should know about the normal metabolic parameters. We should know about the normal physical characteristics, and then we should know about what are the major common diseases, because the most important thing, just like you mentioned already, they are not going to speak to you.
Yes.
Only they are going to convey their message in terms of the behavior.
Oh, yes.
How their behavior is going to change. The most important thing, they are going to perceive their attitude towards you. If you are going to keep them solitude, so they are definitely going to be depressed. So the most important thing is the psychological depression. The first important thing is the psychological depression in terms of the animal. So they are going to apart from your ownership. So fur which is the fur coat, which is going to be fluff, which is going to be damaged, is one of the important parameter when the animal is going to have some sort of the problem in their attitude. Then they are going to keep apart from you, or they are going to move aloof, sitting idly in a separate corner of the room. So that's also the most important thing.
So viewers, you have came to know about two things over here. The physical thing. I mean, you just look at the animal, you can tell that your pet is not feeling well. And if their behavior towards you are changing, then of course they are not feeling well as well. Any other thing? doctor?
We have to see that either their normal taking the feed behavior or water taking the capability is going to be reduced or more intake. Probably in case of the depression, when they are getting some sort of the diseases, which are either the microbial diseases, the parasitic or the fungal or the viral or the bacterial one, the most important parameter that thing they are going to reduce their food intake means that is the appetite.
So correct me if I'm wrong, the change in the appetite is directly related to their well-being, is it?
Exactly.
Oh wow,
Exactly.
I didn't knew that.
Yeah. And then most important thing is then the next thing that is the water intake. Water intake would be reduced, food intake would be reduced. They are not going to share their feelings with you. And then in that case, you have to check their eyes, you have to check their nose, the muscles, foot pads. Because most importantly, what happens in case of the fur, when the parasites attack over there, they are going to harbor in the last distal part of their tail. And then if you're going to comb the tail and clean the comb on the red towel, it becomes pinkish. It means that the worms are there. But the animal is not going to tell you, and you cannot going to see it from the behavior. And it is basically responsible for changing the very first sign, the change in the food and the water intake. And then their behavior, psychological behavior towards you as their pet, because they already have spent a very good time with you. They are going to have the communication with you. They are going to make the love with you. You are going to take them with them outside in the evening, making a walk with you, and everything is going to be disturbed.
So the discussion we just had now, I have picked few things, and I was having the discussion earlier with our kids over here. So and the words which I have picked is one is depression. I thought that humans only have depression, but this is a new insight for me that you have told that animals can have depression as well. And one of you were actually asking me, so I am not the expert. Can you ask directly from Dr. Shahryar about the depression part of the pets you were talking about?
Good morning, everyone. I'm Bella. So I would like to ask Dr. Shahryar, can animals get depression and can it be cured?
Yeah, thank you very much, Bella. Yes, depression, definitely, we all are they are the living beings. Okay, we are human beings, they are the animals, right? So they already have the brain, they already have the thinking capacity. The most important thing, the senses of these animals, they are very much sharp as compared to us. The sense smell, the taste smell, they are very much sharp in case of the pets, particularly we are talking about the cats and dogs, they are very much sharp. Psychological behavior, yes, definitely is going to be disturbed, and in case of any kind of the diseases. So once they are going to be depressed, we can give them the proper attention, or we are trying to find out the reason behind that, what actually leads towards that kind of the depression. Okay. If that is because of any kind of the disease, any kind of the microorganisms, so just get rid of that one. Okay. In that case, a proper veterinarian, a medical doctor, okay, is a veterinarian. He is going to tell you, he's going to diagnose, and preferably he's going to make a differential diagnosis in that term, that what actually leads towards the depression. Depression because of the environment. So what kind of the changes in the environment has taken place which actually lead towards that kind of the depression in your pet. Okay. Just get rid of that thing, pay the proper attention to them, and in case we make and use, in case of the pets, we can use some kind of the antipsychotic type of the drugs which may get rid of this kind of the depression in case of the animals.
Excellent question. An excellent answer as well. That brings me to the second point, which I have picked from your earlier introduction, sir, about the appetite, right? So I'm from a Punjabi family. You know, we eat a lot and we eat good, but that is what I understand. Whatever the biryani we were eating, I was giving the same to our pets as well. And later, when I took my pet to the veterinarian, he said that I am doing it quite wrong, you know. And the same question was asked to me, and same I will say, you have your veterinarian over here. Some of you actually asked me that about the pet food and the household food. This is the time to ask. Go ahead.
Yes, I have a question. So good morning, everyone. I'm Sharon. I have a curiosity about whether is it proper to provide your pets with mixed diet in terms of mixing human food and pet foods.
That was my question, sir. So what's your stand?
Yeah, thank you very much. So first of all, I need to make sure regarding your practice of giving the biryani to the pet, because as we know, it is very much spicy.
Yes.
So we definitely, as human beings, as part of our culture, we like this particular type of the food. And the Sharon question that can we mix the food with this one? So in that case, we need to make sure that the pets, they are having the two type of the practices of the taking the food. Once that is the scheduled portion, the second is the free feeding. Okay, the one you are asking, the scheduled one, means you are giving them the proper food in the 3 times, so 3 meals a day, right? Maybe just like we take the breakfast and make it for the lunch and go for the dinner. So in that case, we are going to give them the commercial diets, which actually contains a proper and a balanced diet, proper proportion composition of containing all the vital nutrients required in terms of the carbohydrates, proteins, minerals, whatever they are present over there. And when you talk about that, whether we can mix them with our own home cooked meal, so preferably it is not allowed. It is not good. It is not good to give them to your pets. Why? There are the 2 basic reasons. The most important thing, their composition of the nutrients which are required, they are going to be disturbed. First thing. Second thing, it is going to disturb the normal microflora of the digestive tract of your animal. Third thing, it is going to change the pH of the stomach of the animal, which may cause the acidity. In case of human beings, okay, we know we cause acidity, we make it take some water, we can take some sort of other medications, but in case of the animals, it's not advisable. And then second thing, in the composition in the commercial diets which are being available formulated, the formulations are being balanced in such a manner which are actually required for the well-being. Okay, for instance, taurine, which is very much important in case of the pets. Okay, and if that is being missing in the proportion in the normal diet, so what will happen? It may cause to the heart disease in case of the animals. So in your normal food, in normal diet, we don't take the taurine. Okay, so that is why if I preferably would advise, do not give them the mix, this mixed pattern with the commercial feed, because it is going to disturb the pattern of the feeding behavior in case of the animals. Secondly, if you really want to switch on to other type of the pattern of the feed, so at least give them a proper 1 week, so that they should be compatible with the other pattern of the feed, containing all the beautiful, important, vital composition or the requirements of the diet.
Beautiful answer, sir. So you have covered out most of the things which I have done wrong, actually. And by just to give you guys information, Dr. Shahriar over here mentioned about the pH. The pH actually tells that how much acidity over there in the stomach of a pet. So if you are giving a home-cooked diet, then that probably contains a lot of fat, a lot of salt, a lot of other things which you do not want to give to your pets, you know, because that is going to make them make their stomach acidic. Okay, that brings me to a very important question, and I was talking to the director of the program as well, and she was telling me that she has not vaccinated her animals as well. So vaccination is important. That goes with the humans, also with the animals. But over here in Malaysia and also all around the world, we keep dogs and cats as pets. So regarding the vaccination, we do understand that it's important. Can you please give us any vegetarian insights regarding that? When they are important, which vaccinations are important, and most importantly, are animals allergic to vaccinations as well?
So thank you. So most important thing, the question you say that why either the vaccines they are important or yes, of course. It's a very classical example right now across the globe, all of the world, the population around the globe are suffering from this COVID-19 problem. So what happens? Before there is no vaccination, we are quite afraid. So since we take the vaccination and then we are taking the booster as well, so we are quite confident that we can get rid of this type of problem. Okay. So in case of the animals, yes, of course. Okay, the most important thing we need to know that what is the average life cycle life period of the pets. It's 10 to 15 years in case of the cats and the dogs. And then we have to see what kind of the major vaccines we should be given. So regarding the vaccines, we divide the animal vaccine into two parts: the core vaccines and the non-core vaccines.
Wow.
Core vaccines are those which are inevitable. So means they are mandatory.
They're essential.
They are essential. They are essential.
Okay.
Just like in case of human beings, in case of the infants, we are taking the measles, mumps, rubella, and all these type of the vaccines.
So that's the message for the director of the program. Some are essential. You need to do that. You can't skip that, even though you have to skip your work. Yes, sir.
Yeah. So the core vaccines and the other are the non-core vaccines. Core vaccines which are mandatory, non-core vaccines which depends upon your normal lifestyle. Where you are surviving any area where there's some disease have the quite pandemic. So in that case, you are advised to take make the vaccine for your pets. In case of the core vaccines, in case of the cats and the dogs, since they belong to the canine family, canines we use the term for the dogs. Feline we use the terms for the cats particularly. Okay.
We are going technical
in our country, yes. In our country, we are taking some sort of these vaccines starting from the age period of that one.
Okay.
So we make a proper schedule in case of the cats and the dogs. So most important, the diseases in case of the cats, feline leukemia virus, FELV. Then we go for the FRCV, feline retinovirus, virus rhinotrichitis. And then in case we go for the canine distemper in case of the dogs. We go for the rabies. Okay, and then we go for the general dewormers. So these are the then we go for the DHPP parvovirus. Okay, so we specifically give them the proper time at what time period these vaccines should be given. Starting from the 6 to 8 weeks. For instance, in case of the dogs, we should go for the DPPV for the vaccines. Then we go for the 9 to 11 virus as a booster for the Borrelia vaccines. Then we go for 12 to 15 weeks for the rabies and the DPPH booster, and then we go for the annually for these kind of the vaccines. In case of the cats, again, we starting from the week of the 9 to 11 weeks, we go for the FELV vaccines. Then the 12 to 15 weeks, we go for the booster for these FELV vaccines, and then we go for the general dewormers. Again, we go for annually for the rabies and the general dewormers. General dewormers, they are very much important because since we know these animals, they are having a fur. Some owners, they don't like the fur, they make a shave at the clipping. The chance of getting the parasites on their skin is less because the parasites, they cannot be hide over there. But if the animal having the fur, long hairs on your pets, so it is a proper place, a classical place, is a hiding place for the parasites to go and stick. And then they are going slowly, they suck the blood and the animal become emancipated. You think that animal has dropped down its feeding behavior, but that's not, because the parasite is going to suck the blood. So in that case, general dewormers, shampoos are available, some oral medications are available, and then some boosters are available in terms of the parenteral injections, intramusculars can be given. So these are the vaccines which should be given. So it is very much important because it is the matter of your life of your pet. Because if your pet will not be saved, it may cause a disease to the other members of the community, maybe to other animals, or maybe spread to in your own home as well. Because they become the harbor of these diseases. For instance, the rabies. It can be transmitted to the human beings as well with the bite. So cat scratch diseases and the Q fever, the rabies, these are very classical diseases which may get to the human beings and to the other animals if the animals has not been vaccinated properly.
So sorry to stop you. I have a jargon and I have to use it to show myself I'm an expert as well. Are we talking about zoonotic diseases?
Yes, exactly. We are talking about the zoonotic diseases. Zoonotic diseases are those diseases which are going to be transferred from the animals to the human beings. Since we keep the animals at home, so most important thing, because if you are family members, you're having your own kids, so maybe your kids are going to play with them. So what happens, maybe while playing with them, see the animal having the long nails, or your cat or the dog is going to scratch on the body of your child, of your son or your daughter. So maybe what happens, the disease is going to be transferred through the nails to you if the animal is not being vaccinated. Zoonotic diseases being transferred from the animals to the human beings, and then it causes the problem. It is a very important topic. It is very important thing, which is going to be having a very extensive type of research is going on that to identify which kind of zoonotic disease are preferably over there. Because if the disease are going to be transferred to the human beings, so it's not the matter of the animals only, no, it becomes the matter of the human beings as well. So we also can take the example of this COVID-19. Since the inception, a couple of years ago, it started from the bat. So bat once has been consumed by the animals, the meat over there, and then it transferred to the human beings. So the zoonotic diseases, so we need to consideration what kind of the diseases which are zoonotic in their importance, and then how they are going to affect the human beings. And then we try to get rid of these diseases from your own pets.
So one of our young pharmacists over here, and I'm not going to steal her thunder, she was talking about something, the allergy. Which one were you, right? Yes, please go on.
My name is Rachel, and I'm from Bachelor of Pharmacy, and I would like to ask a question. So for cats and dogs, what are the common allergies that they may have that we should look out for?
Okay, thank you, Rachel. Regarding the allergy, you are saying this one. So most important thing that the allergy is either to them, skin allergy is very important. Skin allergy is very important case. Then the food allergies, they are also very much common in case of your pets. So the food allergies, rather we have to identify that what kind of the foods your animal is not taking, right? Or maybe is got any kind of the disturbance in its behavior, or any classical signs, symptoms appear which are not helpful or which are not medically fit for your animal. Okay, we can switch on to the other food. The second thing is the skin allergy. Skin allergic means allergens, okay, for exposed from the environment, the fungal infections, the worms, they come in contact with the skin of the animal, and then they cause allergy over there. In that case, yes, definitely we can switch on to some sort of the medication. A veterinarian will definitely advise you some sort of the antihistamines or any anti-allergen type of the medicines. But the most important thing, why they are getting this type of the allergies. Okay, maybe preferably present in the environment, and is sporulated type of the fungus environment over there. So that is why we should have to take their good care, give them the proper optimal environment where they can breathe properly. Temperature is quite optimal, oxygen sufficiency should be there, okay, so that they should not be got the allergy from the skin or from their food behavior.
That's a very good answer, sir, and so as the question as well. Now, we have discussed quite important things over here: vaccination, pet food, household food. But I believe our viewers specifically wants to know about the diseases now. And I would really request you can you please break down the diseases? What are the early age? What are the middle age ones? And what are the kind of diseases we should look at the pets when they reach at the last part of their life? So.
Thank you. So regarding the disease, very important thing, because since once we know that what kind of the disease they are present over there, we can get rid of these type of the disease with the help of the medications. Okay. In case of the cats, squamous cell carcinomas, they are the two type of the diseases. They are the microorganisms, and the other one they are the non-microorganism based. Squamous cell carcinoma is very important type of the disease in case of the cat as well. Okay. And we can get rid of this one since the cat becomes at the age of its puberty. Once the cat takes the very first menstrual cycle at the very classical time to get this kind of the infection, the problem. So what kind of the, if you try to find out just when during your proper examination, if you find some sort of the lupus, some sort of the bumps are present on the skin, it's a classical sign that the cancer is going to be originated over there. So then you have to make sure either you have to go for the radiographs and you have to make the screening with the other procedures with the help of your veterinarian. Okay. Cancer, then obesity. If you give the animals the free feeding behavior, so it can lead to the obesity. Then may lead to the diabetes. Diabetes is not the problem of the human beings as well, it's the problem of the animals as well. So because since the glucose level goes up with the free feeding behavior, animals take care excessive kind of the proteins, carbohydrates, the fats, it may lead to the obesity in case of the cats and the dogs as well. Then the kidney problems, kidney diseases in case of the kennel cough, kidney disease, leptospirosis, okay, canine distemper, and rabies. These are the very much common diseases in case of the dogs. First thing, how you're going to identify, how you're going to classify, and make the diagnosis. The most important thing, the signs, symptoms, they are very much quite common in them. They lost the appetite, they reduce their food intake, they reduce their water intake, some sort of the pus being originated from the eyes, nose, then the diarrhea would be there. Okay, the most important thing is the bad smell from the mouth. If you find out that if the nail polish remover smell is found in your from the breath from the breath of the animal, is a classical sign of the kidney disease in case of the dogs. So we need to get rid of that kind of disease. Then the animals, how the animals are going to spray in the urinate. In case. So kidney disease, a very much common case of the dogs, in the cats as well. So diagnosis and the differential diagnosis, preferably, particularly by the veterinarian, will let us know what kind of a disease they are being present over there, and the medications definitely be available over there, depending upon the nature of the organisms, depending upon the nature of the disease and the stage of the disease. We cannot classify, as per your question, that what kind of the disease they are specific for the middle age, for the initial age, and for the large kind of the age. It depends upon the nature of the diet, nature of the animal, the environment of the animal, and its habits towards any kind of the its habitat. Okay, so kidney stones, they can be developed. They again depend upon the nature of the diet. Obesity can be at any age, maybe at the age of the very beginning age, or maybe at the terminal stage of their life. Okay, but the most important thing, we can classify that the terminal age of the animal is heartworm. Okay, heartworms, they are being present. Heartworm name indicates something to the heart, but it's not actually towards the heart. It's basically the problem of the respiratory system. Oh wow! The name is the heartworm, but the problem is with the respiratory systems. It may cause to the bronchitis, it may cause a problem in the respiratory disorders in case of the dogs. So we need to identify, and the lungworms, fluke worms, ringworms, tapeworms, they all are being present in the digestive tract of the animals in both cat and dogs. And again, they depend upon either they are going to take some sort of the contamination, they are playing in the soil, they are playing outside in the streets, and they may take some sort of the worms from there, which are going to multiply, which making the fat belly in case of the cats, and they are continuously multiplying within the stomach of the animal.
So wonderful answer. I did not knew that the animals or the pets we have can have diabetes, but of course, like you said, the excessive diet can lead to the obesity, and obesity is the potpourri of a lot of diseases. So thank you so much to you. Thank you so much for our young pharmacist over here. And I believe that our viewers have learned a lot from Dr. Shahryar. So thank you so much one more time. He has given us very important insights, not only how to keep your pet healthy, but also how to understand your pet better as well. Diseases we have discussed. The depression part was very exciting. Vaccination was very exciting. Allergy part was very nice. So that was very good. So with that, I'd like to conclude our today's session. But before we leave, we have a pet competition, guys. So you can take part in that competition. You can get all the details from our Instagram page. You can make a 1-minute video. You can be part of that 1-minute video competition. And we have very exciting prizes you can win over there, right? So please do visit our Instagram and Facebook page. And with that, thank you so much. Stay safe and enjoy yourself and love your pets. Thank you so much, sir.
Thank you.
And thank you, everyone.